Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
Exactly right, Candy. You talk about helping change people's lives. Well, we'll start with one doctor doing just that. From My Bariatric Solutions, it's Dr. Scott Stowers.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors, and with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Having a breast augmentation was something that I've wanted to do for a long time, and finally I just had enough courage to pursue it. And my fiance knows Dr. Azouz, so he contacted him and we went and met with him.
Nadia came in with her fiance, and she was complaining that her breasts were too small and saggy. So it wasn't just a question of volume. She wasn't looking just to be bigger. She wanted her breasts reshaped. She felt that her nipple areolas were too low, and she basically, for a woman in her mid-30s, she had very saggy breasts, and she wanted them larger. She wanted to have this done before she got married, and we were planning a breast augmentation and a breast lift at the same time.
And he said, well, I can take you the following Friday, and I went ahead and scheduled it. So I didn't give myself any time to really think about it or contemplate, second guessing my decision.
There are basically three types of implants that we use for breast augmentation today: the saline implant, the silicone gel implant, and the new implant, which is the cohesive gel implant, sometimes called the gummy bear implant. Depending on the patient's desires and needs, the saline implant can work well, the silicone implant can work well, and of course the cohesive gel, the new implant, can work well as well. It's an individual thing depending on the patient, depending on what her anatomy is and what I think would work best for her. And once we've discussed that, the patient and I usually decide what implant would be best for her.
The initial consultation with Dr. Azouz was pretty lengthy. He's very thorough. He takes a long time to make sure that he walks you through each step and process.
The surgery itself is not that long. It's usually around an hour. And then the recovery for the breast augmentation and lift can be 4 to 6 weeks.
The results from the surgery, I went from a 36C to a 36 double D. Thanks to Dr. Azouz, I feel much more confident in myself. He did an excellent job with my breast augmentation, and I would highly recommend him to anybody.
Brushing is not enough. Invest in some dental floss. No matter how thoroughly or long you brush your teeth, you are missing a good portion of their total surface. There are also dangers of skipping floss. The bacteria that lingers can increase your risk of heart disease.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great, but there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him, and I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Hi, my name is Dr. Michael Rimlawi. If you've been told you need traditional back or neck surgery, you need to check out my latest videos on minimally invasive spine surgery on bestdocsnetwork.com.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The aspirin after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because it's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the
Antibiotics can't eradicate it. What the aspirin after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy and to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting, and that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc. Or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause a spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Accuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more often. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times?
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. What did I need that was extra? Was I comfortable? And I was never left alone.
Everybody at Preferred Imaging was really great. The staff was professional. It was my first MRI, but I thought the experience was awesome. I didn't expect it to be so smooth. When I actually had the MRI done, I had to lay there for like 45 minutes.
doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really like kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
For more information on all the outstanding doctors you see on today's show, as well as request an appointment, you can do so. Head to bestdocsnetwork.com. That is bestdocsnetwork.com.
And now we're going to check out with our next best doctor. It's hand surgeon, Dr. Dustin Ray.
Carpal tunnel syndrome basically is a problem where you have a nerve that's here in your wrist. That nerve shares a common space. It shares it with 9 tendons. When those tendons swell, that soft little nerve gets pinched. The patient can then begin to have numbness and tingling, and if it's there long enough, can notice that his grip strength or her grip strength is diminished. It's important to treat carpal tunnel syndrome early and not wait too long, because the longer that nerve is pinched, the greater the chance that nerve can become permanently damaged if left untreated.
I've been dealing with hand numbness and pain in my hands and fingers for probably 15-20 years. It progressively got worse, and it got to a point where I couldn't sleep anymore. I couldn't write much more than a check out without a pen falling out of my hand. I would run my fingers through my wife's hair and not be able to feel it on my fingers. And you know, I was missing out on a lot. Keeping me up at night or waking me up at night, it would hurt all the way up into my armpits.
When Steve came to see me in the office and he told me his story, it definitely sounded like he had carpal tunnel syndrome. After examining him and after getting a nerve study to confirm what we suspected, it came back positive for carpal tunnel syndrome in both of his hands. So we proceeded to do the surgery to treat his carpal tunnel syndrome.
The procedure we went with was the endoscopic. I could sleep at night now. I can feel my wife's hair when I run my hands through, run my fingers through her hair. I'm doing just about everything I used to do before.
The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. You actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Stretching can boost circulation and digestion and even ease back pain. Remember, when stretching, hold each position at least 25 seconds and to breathe deeply. And welcome to the Best Docs Network. In the studio, we are proud to have Dr. John Barnett, one of the top plastic surgeons in the entire Dallas-Fort Worth area, known for creating some of the most beautiful breasts in the world. What makes a beautiful breast?
Looking natural, feeling natural, and acting natural. By that I mean when the woman moves, they bounce.
All right, Dr. Barnett, you use saline implants and you put them on top of the muscle. Why do you do that?
The saline implants, you have an adjustability factor. Most women are asymmetric in the breast. So you can get them to where they look equal, almost exactly equal. You can't do that with a gel. You got to order different sizes, and they don't come in 10 cc increments. So it's very difficult to get the size right by eye. As good as I am at that, I can't just eyeball it exactly how many cc's difference. Okay, number one. Number two, that's how everybody was taught to do it on top of the muscle. It sounds like a logical idea, but it's a false assumption. It doesn't work. Here's why. Skin stretches. That's why you can take somebody who's really flat-chested and turn them into a 34, 36C. It looks great and natural. Skin stretches, but so is that muscle stretch. It starts out about like this, and then it ends up about like this. There's no going back from that, okay? It still retains some contractility. That's why when they flex their chest wall muscle, the implant will move around. Looks really nice, really natural, looks good. So when you put it under the muscle, it's an anatomically and physiologically abnormal thing. If a woman's breast is a little bit low set, you have what's called Snoopy's nose effect. Your breast sort of falls off the end. Here's the implant way up here, and the breast sort of falls off. That's why a lot of people get breast lifts in association with their augmentation, because the surgeon's trying to make the patient fit the operation rather than the operation fit the patient. You know, there are a lot of people who got a lot of scars on them that they didn't need.
The Best Docs Network is all about outstanding doctors helping change people's lives. Like our next doctor, spine surgeon Dr. Michael Rimlawi.
I was in a bad car wreck in 1985. A drunk driver hit me, and I wasn't hospitalized, but it was, I took a pretty good hit to the neck and head. My life had got to a point where I couldn't even walk around the block without being in neck pain. I was having a lot of difficulty at work. I'd been playing water sports, and it got to a point where I just had to give them up because it was just causing too much pain for my neck.
When Monty came to see me, he was complaining of a lot of neck pain, and arm weakness. We looked at his MRIs and x-rays, and what we found was a disc herniation was hitting part of his spinal cord and his nerves, and that was causing the pain shooting down his arm.
We had waited several years for the technology to get better because all the doctors had turned us away, but when we came to Dr. Rimlawi, he explained how technology was real advanced now in the neck surgery area.
Because of new technologies today, we can perform surgeries that are muscle sparing, and that really is huge because traditionally surgeons cut through muscles, and what we realize now when you do that really causes a lot of bleeding, which leads to scar tissue, leads to more pain. So we go in between muscles, and there's a muscle going this way and a muscle going in here, and we go in between the muscles and get down to the neck, and they were able to shave off bone spurs, take out a disc herniation that's hitting the spinal cord, free up nerves, put in new discs if we have to, and stabilize the neck. And doing that, it makes it much easier on the patient, much quicker recovery, less blood loss, less scar tissue, and it's just not as painful of a surgery at all. And a lot of times patients really experience very little pain.
I'd had surgeries before. So the day of my surgery, it was only supposed to be about an hour and a half long, so I wasn't really nervous, but I was excited to have it over. And so when I woke up, that's the first thing they asked me if I had neck pain, and I had no neck pain. So after 10 years of neck pain, I'm finally able to go back to a normal life because of Dr. Rimlawi.
Let's talk about the irritable bowel syndrome, IBS. Very common, more common in women than men, more common in stressful situations than not stressful situations. And what are the symptoms? Well, generally people have alternating diarrhea and constipation. Now, some people just have either diarrhea or constipation, but most people it's alternating. Also, people who feel full after they eat and then feel great after they have a bowel movement because they clear things out, that tends to be IBS also, irritable bowel syndrome. Now, it's important to know irritable bowel syndrome is what you have rather than something else because there are bad diseases that can be signaled by a change in bowel habits. So if you have a change in bowel habits, go over it with your doctor. If you do have irritable bowel syndrome, there are medications you can take, but most people get by with doing things like over-the-counter probiotics, over-the-counter fiber tablets or fiber supplements like powder. And drinking lots of liquids, trying to avoid stressful situations, and keeping a trigger diary. Trying to figure out what you ate or drank the day before you had your problem will tell you what to avoid so you don't have IBS flare-ups.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases rarely that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It's also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problem is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.
Well, thanks for tuning in to another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And for more information on any of the outstanding doctors you see on today's show, of course, Candace, the folks will make it easy on them. Head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com.
And if you have a question or comment for us, we'd sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We will see you next week.